Okay, Dr. Kara here, driving in my favorite car, classic American Mustang. So one of the questions I get asked the most is how in the world do I get out of whack or restricted? This is my dog Monkey. So one of the things is how are you driving? And I picked my car because this is probably the worst position ever. Okay, Monkey, go in the back. Poor little guy. So basically, if you watch my shoulder, it's shoved forward, and my neck is at an angle, and most of the time you can't avoid that, okay? The headrests are supposed to be above your head, so my headrest right now is too low. The seat is kind of back, right? So right here, I'm basically a professional sloucher. That isn't good for your middle back, so I'm going to create a flexion. And then in order for me to look over, I gotta sit up and look over, which can create a lot of rotation in the lower back, okay? So we don't wanna do that. We wanna bring our seat up. The headrest is always gonna be somewhat forward, but as you can see, mine, you can almost set it. And the reason why, there's a science behind that, because when you get in a whiplash, you actually come up and over. So if I were to get in an accident, and I would come up, I would now tear the front of my neck. But if this is higher, so if I bring that higher than my head, I can't get up and over, so therefore I'll be whipped forward, but when I try to go back, it's not gonna rip. It's gonna strain muscles, which is better. Now for the lower back, when you're driving in your car, I love this little purse because it's just the right size to basically be a pillow, okay? So some of you might get a pillow at home. I'm going to bring my seat back a bit. This is also something I can travel with in the airplane. I can bring it upright. Now my neck has some room. I have some support in the lower back versus being scrunched forward. And as you can see, I can bring my shoulders back and down with my head aligned. Sometimes you can even hear that in my voice, whether I'm straining or not. So if I bring this back down, again, my low back now gets flexed, my mid back is flexed, and over time, I'm going to have some lower back pain, most likely from this. So obviously, people drive more than just a Mustang. I had a Jeep Cherokee Sport I did this with. I got a little bit flatter pillow, even in the airplane seats. Ladies, it's easy when you bring a purse. This one's a cross back, so I can wear it like a backpack and put it behind me. I can have it a little bit lower. I do that in the airplane also. Some cars have a lumbar support where you just push the button. Now, so does this one. Literally, right now, I'm pushing the lumbar support button. So basically, there's a little air bladder behind my lower back right now that goes from me being completely in a bucket position to being to having a little bit of pressure. This is not enough. So I will go ahead and push that button all the way to the front. And that's it. Did you notice a big difference? Me either. So they're trying. We'll get there. Eventually we will consider how we are moving and how we are positioned while we're doing these things all day. But until we start paying attention to ergonomics and how we can hurt ourselves a little bit over time, just like we can spend a little too much money over time, just like we can eat a little too much food over time, we just aren't very good at the accountability stuff in any of the departments in our life. But ergonomics are kind of important because if a joint goes down and you need to repair that past conservative treatment with chiropractic, occupational therapy, physiotherapy, whoever your flavor of choice is, if that joint is locked, it's locked. If you grow extra bone, you grow extra bone. If you've loosened it up, that's quite an ordeal. It's fixable, and for a couple $1,000s in a year's worth of work, you can avoid all that if you sit up straight. If you don't, and you say, what the heck? we're talking about a surgery. One surgery at one segment can be somewhere in the ballpark of $70,000. So I don't know about you, but at my income as a chiropractor, $70,000 is a pretty big chunk of change. And I would love, that's an entire year's salary for a chiropractor. I would absolutely love to have that in my pocket just to sit up. So I don't mind sitting up straight and being paid quite a bit of money to not have that problem. So get in your car, get your ergonomics, look at your headrest, get something behind your back, get your shoulders back. And in the next video, I'll show you some exercises you can do while you're driving and still be safe. Aloha.